This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So let's tell them what's on the agenda for today, Heather.
So today we've actually got our first two-parter. And when I say two-parter, I mean our conversation was so good that we had to break it into two episodes. So today we're going to hear the first half of our full discussion with Latham Thomas. She's the founder and owner of Mama Glow. After giving birth to her son, Fulano, in 2003, she set out on a mission to help women reclaim birth. She's a graduate of Columbia University and the Institute for Integrative Nutrition. Latham is a maternity lifestyle maven, world-renowned wellness leader, and master birth doula on the vanguard of transforming the wellness movement. She was named one of Oprah Winfrey's Super Soul 100. Latham is bridging the gap between optimal wellness, spiritual growth, and radical self-care, and is the go-to guru for modern holistic lifestyle for women. She authored the best-selling book titled Mama Glow, A Hip Guide to a Fabulous and Abundant Pregnancy in 2012, and most recently published bestseller Own Your Glow, A Soulful Guide to Luminous Living and Crowning the Queen Within. Yes, Queen! Latham serves on the Tufts University Nutrition Council and is also a member of the Well Plus Good Council, where she provides expertise in women's wellness, pregnancy, and self-care. In March of 2018, Latham released the meditation audio program, Meditations, Guided Meditations and Rituals for Rest and Renewal. She teaches at universities and teaching hospitals around the country, helping to improve the patient labor and delivery experience. Whew.
Oh.
She's one heck of a lady.
Teaching and writing books and wow. All right. Well, that sounds like this is going to be quite the conversation indeed. And yeah, it's part one of I mean, it was that good. It really was. It went like an hour and a half. We couldn't stop talking. So yeah, without further ado, here's part one of our conversation with Latham from Mama Glow.
Hi, Latham. Welcome to the Healthcare Uprising podcast. Thanks for joining us today.
Thank you so much for having me.
Great. Well, let's dive right in. So first and foremost, can you tell us about your background, your experience, and really ultimately what drove you to establish Mama Glow, and tell us a little bit about what Mama Glow is all about?
Sure. My name's Latham Thomas. I'm the founder of a global maternal health and education platform called Mama Glow, as well as Mama Glow Foundation, which is our nonprofit. And Mama Glow really seeks to address maternal health outcomes across a few primary ways. And so one is by training a workforce of doulas. And so we've trained over 3,000 doulas globally since 2018, as well as nurse care managers in doula competency. And then we match doulas with families, right? So we do workforce development, which ensures that families get access to structurally and culturally competent care through doula support to navigate the healthcare system. And then on the foundation side, we have pro bono programs for people who may not be able to afford doula services. And in New York City, we are the largest provider of pro bono doula services. So anybody who comes through that's Medicaid eligible, that's aging out of foster care, that's maybe living within our shelter system, or even a teen mom, those people are eligible to get free doula services through the Mama Glow Foundation. And so it's really about having, as we see it, like a multi-pronged approach to addressing care and ensuring that patients have and clients have like the best experiences possible, as they navigate their maternal healthcare journeys.
Can I jump in and ask a very layman's question?
Yeah.
Uh, can you, I, I, Heather told me we were interviewing a doula, and I didn't know what that was.
Sure.
I did look it up, but for our listeners who are like me and don't know what
What
that
is it,
means,
right?
can
Yeah.
you
What is a
explain?
doula?
And even after reading about it on Wikipedia, I'm still not exactly sure what an
Yeah.
actual doula would tell me they do. So,
Yeah.
can you, in your own words, explain that, like what a doula is and what kind of services you actually provide?
Yeah, so doulas are non-clinical care providers that offer everything from emotional support to physical support, education, advocacy tools. If you have a partner present, they'll make sure your partner has the tools they need to also navigate the process. And they're also there to help you sort of like if you think about it like having a producer for your birth, right? Like if you were doing a wedding and you're planning your wedding and you're like, oh, what are all the details and things I have to think through to make this day very special? Sometimes people hire folks for that or they engage their family members. And a doula is sort of like that person that you would engage who's thinking about all of the aspects of the experience and how to help it go as smoothly as possible, but also to help you in an emotional way, right? And so, in the ways that your providers may not be able to step in to show up for you emotionally, doulas can, right? And so they're there to be sort of this cheerleader and someone who's listening to your unique needs and designing a care plan that speaks to your experience and the experience that you desire. And so, really, it's like a position I would say that evolved over many years. This was something that was happening within our communities, right? It wasn't like an actual career or role. It was really just like a community role that someone would hold. And when it was time for you to have a child, when we were more living in our tribal sort of like networks, we would have someone who had this designated role that would serve alongside people when they gave birth. And so it would be somebody you already knew. And today, as we live in a more fragmented society where people live at an accelerated pace and they live further apart from their family members, and so they don't have that same familial unit, you don't have like, when I grew up, it was like we lived down the street from our grandparents and our aunts, and we would, and all the neighbors looked after us. And nowadays, people don't even know their neighbors, right? And they live very far away from their family members, and even like their parents might not even live in the same city. And so when you have a child, it can be really isolating to navigate that experience without familial support. And so doulas kind of help fill this care gap that's necessary in sort of how we've evolved culturally. And they also help to fill some of the policy gaps that we have when it comes to care. If you think about maternal health on the other side of birth, right? When people go home and then they have to go back to work. We have 1 in 4 women head back to work 10 to 14 days after having a baby.
That's
And so
crazy.
Seriously?
yes,
It's
one in
crazy to
four
me.
in this country, because we don't have a federal paid leave policy in place, right, for people to draw from and be able to stay home with their children. And we're the
Yep.
only developed nation that's like this, right? So a doula can really be very helpful in helping people transition into their new life, right? And how they can help organize and set them up for success in parenthood. So it's really like I said, having that like kind of event planner, cheerleader, but also someone who's highly skilled in, understanding the emotional waves that someone's experiencing as they navigate new parenthood.
Yeah, I was explaining this to my husband last night, and I've had 2 kids, and did not have a doula, although in hindsight, I sure wish I had, particularly for my first delivery, my first son, because it was a really awful experience, very emergent, pretty traumatic. And a doula could have advocated for me. And that's how I was kind of trying to explain it to him is that they're an advocate for you during the birthing process, to ensure that, like you mentioned, you stick to your care plan because unfortunately what happens, and speaking to the choir here, but for anyone listening who doesn't understand this or hasn't been in these positions, when you're in like crisis or even, not, right? Because birthing and it's a physical trauma to your body. It's a difficult thing. It's hard to make decisions sometimes. And you
Yeah.
may not be thinking straight, And
Yeah,
so
we're not thinking straight. I want to address a couple of things you said, which are true. You are not thinking straight. Your brain's actually doing something completely different than normal. So a couple of things happen when you're in labor, neurologically speaking, right? We talk about neuroscience. What's possible for birthing, what makes birthing possible is that we have to actually move out of sort of this like wakeful state that we're in, as like how we are right now, right? Which is like our beta brain waves, like we're in an active state of awareness. We have to actually shift out of that and move into the default mode network, which allows us to be in a more sort of rest and digest mode, right? Or like not fight or flight, but we have to actually be in a space of ease. We have to be in a space where we feel safe, right? You can only birth if you feel safe. And so the actual sort of the shift that the body and the brain require of us actually to move into the process of birthing is under threat with our current medical model, right? Like the way we currently process is like antagonizing to what actually the body needs to feel that sense of safety and security. So as you're describing, you're not in your right mind, you're not, right? Like your neocortex has to shut off, like your other parts of your body, actually your most primal mammalian aspects are like fully firing and underway. And our limbic system, which is the emotional motor system, which helps us to govern the experience and sense of emotion, actually helps to help that process unfold. Because if we feel safe, if we feel loved, if we feel supported, if we feel like we have capacity for birthing, right? If we're made to feel that in that process, we will actually start to secrete the hormones that support labor unfolding. Right. And so it's actually the brain and the body that work together in this beautiful way to synthesize a process that's like on a primal template that will happen on its own, right? If undisturbed. And so you're right. You're in a totally different state, right? You're in an altered state of consciousness, which is what birth requires of us. You're absolutely in an altered state of consciousness. And you're also experiencing a rite of passage. Birth is actually a rite of passage too. You go through a preliminal or separation phase into the liminal, where you sort of enter this veil, right? And you come on the other side of it into the post-liminal phase, or past the leman, which means threshold, right? You pass that. And so through this process, you have to actually undergo this symbolic disintegration of yourself, right? If you think about how caterpillars become butterflies, right? There's a symbolic, but also physical disintegration. In birthing, it happens as well. This part of ourself that once was, right? We have to sort of shed to become this next version of ourselves. And so you're right, like that there's this part of you that's really vulnerable, right? And you have to trust the people around you. And if you're not made to feel safe, you can leave that experience, feeling less empowered, right? Or feeling like you lost something, or that you didn't get something you were supposed to get in the experience. And I think a lot of people leave with that. And and what I have noticed, right? There is a difference between people having experiences where it didn't go as planned and still feeling satisfaction, and
Mm-hmm.
people who had experience that, didn't go as planned and feeling traumatized. Right. And so you can have, and our job, right, is to come in, right, when the doulas are coming to support, through pregnancy into the labor and the postpartum period. It is to help preserve the memory, right? Like how I think about it, that's the job, is to preserve how you tell this story, how you remember it, what you actually recall. Like I'm invested in those details. And
I
so,
love that. I hadn't
right,
really considered the role of a doula to serve
preserve
in
the
that
memory.
space. And that's really wonderful, because when you are in that, situation of birthing, you can not remember details, because it's like you're going through the motions, and
Yeah.
yeah. And
It sounds a lot like you act as a guide to get
Yes. Not a
to
guide.
you help with the perspective and the experience of the thing, and just like take the stress out of it. And So yeah, that's okay. I have a much better understanding of what you do now, actually, I
Is
think.
it better than ChatGPT's explanation?
Oh yeah, my DuckDuckGo AI had nothing on that. Like Wikipedia will tell you the basics, but that was a much better explanation for it.
Well,
Yeah.
and this is the one of our biggest goals with the Healthcare Uprising podcast is to educate and create awareness. And so this is great because there's a lot of people that probably are going to be listening to this and don't know what a doula is, and now they will. And one other thing too, I want to touch on because Jeremy and I were actually talking about this. In fact, again, as I was prepping my own husband for this episode last night, he had so many questions, and he's like, "Well, what about a midwife?" So, how
Hmm.
is a midwife and a doula similar and or how are they different? Can we maybe talk
Yes.
about that because I think there's
Yeah.
probably some confusion there from the
Yeah. And
regular.
so there is always confusion between the two, and there's a few reasons for that. Part of it's deliberate because the confusion, and then I'll explain the difference. The confusion, whenever there's confusion, it can hinder progress, right? And so when we think about healthcare and our healthcare system, and what keeps us from being able to problem solve or allocate health funding appropriately, largely is because people don't understand certain concepts, right? So a doula, as we already established, is a non-clinical care provider, whereas a midwife is a clinician, right? So they are care providers who work within the healthcare system. They essentially do everything that your OBGYN would do. They provide well woman care. You can get your pap smears and annual exams with them. Typically, you would have the same reproductive life course, sort of checkups and screenings and care you could get with a midwife as you would for your OBGYN, right? And a midwife, the difference obviously between the care that a midwife will provide and an obstetrician is that an obstetrician is obviously a high stakes technician, right? Like they are there to provide surgical deliveries. They can obviously do vaginal, but they are skilled for and trained very specifically to provide emergent surgical care, right? And so, and really to be able to perform in situations where a vaginal delivery would not be safe for the mother or baby, but also to provide vaginal deliveries as a normal mandate, right? As a normal birthing pathway, right? It should be that most providers have lower than a 12 to 15% C-section rate we see in the country. Now it's around 39, sometimes 40%. In other places, across the country, depending on practices, it can be really much higher. And so, that's the obstetrical route. When we talk about midwifery care, we're talking about care that is happening in a hospital, a birth center, or a home, right? Obstetrical care is only happening in a hospital setting or a hospital that has a birth center within the hospital, right? So like almost like a store within a store kind of environment. You can have where there's like a floor that's dedicated to sort of a different type of model, which is the midwifery model of care within the hospital system, right? But when the midwives are working in that environment, and those are typically certified nurse midwives, when they're working in that environment, they are also aligned with the institutional goals. So they have to follow sort of that pathway that feels aligned with obstetrical care, if that makes sense. If you're in a home birth setting or a birth center, and birth centers that are freestanding, meaning that they are outside of the hospital and they are governed by midwives and staffed by midwives. Those are places where you can go. And typically, how it works is you would go on a rotation, right? Where you would see multiple midwives, and whatever day that you're delivering, you would be able to deliver with that person who's on call. You can also work with people on an individual, level, like people do when they, hire their physicians for deliveries. So the model of care can look similar. The care delivery will be really different. Midwives often will come to your home to do appointments. And so you have like house calls, right? Where you're on your couch and they're using a Doppler to actually help you to hear and track and locate the baby's heart rate. They will do things like measure the uterus and your growth. They can do that from your home. Sometimes they have their own practices where you will go into office, but oftentimes there's this kind of, more familial and more sort of uh, I would say just like it feels more community, oriented
Mhm.
model, right? So
I didn't
that's one of
realize midwives can come into your home. That's a new
yeah,
one for me.
yes,
That's
they can come to your home. Most of them have you come into their office, but
okay.
they can come to your home too. But yeah, that's what it looks like. And so for doulas, they work alongside the midwives, they work
Mhm.
alongside the physicians, right? So we're just an added member to the care team. You will often find that there are doulas who go to midwifery school because they want to sort of take their work to the next level. You'll often find midwives who slide into the role of doula when they go to, say, a birth ends up being an emergency where you have to head to the hospital. Then they move into more of a doula role when the physician that's going to take over the care ends up stepping in, if that makes sense. So it's really like I would say more modular, in some situations, like how folks work together. But generally speaking, if you do work with a midwife, those are folks who are tending towards home birth or out of hospital in some capacity, whether it's in a birth center at home or working, with midwives in the hospital, which is an option in some places, not all. And so just really learning the landscape and what your options are, I think is so important. And for people to really, as we sort of navigate a new terrain in a sort of post-Roe world where we're trying to understand what our rights look like, and understand what care options look like. It is important to feel like you have autonomy and body sovereignty. So being able to make choices that align with your needs, because not everyone is a candidate for home birth, but not everyone's a candidate for hospital birth, right? And so we
Mhm.
do need to learn the type of person we are and then design a care team to kind of support that.
Um, Jumping back to something you said earlier in that, do you have any thoughts on why the rates of surgical birth, cesarean sections and whatnot have exploded like that?
I'm so glad
That's a
you asked that.
ridiculous number.
I was going to ask the
Yeah.
same question.
It can't be necessary for half of women giving birth to get cut open. Like
No.
women have been
Yeah.
giving birth without getting cut open since humans are a thing.
Yeah.
Right. Since
Like
these are a thing.
I
Exactly.
understand that sometimes it's necessary, but how does it go from 10% to 50%? Do you have
Yeah,
thoughts on that?
that's huge.
It
Yeah.
is. Yes, I absolutely do. So a couple things happen here, and thanks for that question. So so one of the things I like to teach a lot and help people understand when they're trying to understand like how our systems develop and then how we get to a place where we are currently, it's really important to understand like what the philosophy is that underpins our medical system. And so I try to talk to people about a couple pieces. One is looking at the industrial age, right? So if we look at sort of this period in the 1600s where we were introduced to this philosophical thought that started to bridge concepts around law, order, and sort of like this sort of obedience, within our systems, looking at the solar system as a space where law and order was being governed, looking at the world as a place where this is happening, but also looking at machines, right? And so we're moving into an age where people were, moving from their farms to like into cities and starting to do manual labor. Even children were doing this labor, and you're in this workforce, but the world that like sort of is being shaped around you is governed by machines. And so we start to get this philosophical kind of uh literature and conversations that become part of the Western canon that start to help us frame what this world is from the lens of machinery. So we start to talk about the body, right? This is where the emergence of the body as a machine comes, right? We start to talk about the body through the lens of machinery. We start to talk about the body in terms of like if you think about even when we talk about the different organs and their functions or different systems, right? We are talking about that through this lens, like everything. When you go to your doctor's office, they often talk about your body like it's a car, right? And so they'll give you analogies and things that use machines as underpinnings. But also when you think about machines, right? You're talking about something that is inanimate, right? And unless it's like actively, functioning, it's not like a person with feelings, right? But it either is working or it's not. And when it's not, something's wrong, right? Something's wrong with the machine. And so when we do this overlay onto humans, it's a little complex because you can't just say, oh, like a carburetor is broken, right? Like something's wrong, right? It's like we can have symptoms of things being wrong that's actually information about what's happening in our body and largely what our body's doing to protect us. And so I use this as a lens to talk about birth because at the same time, there was this march towards mechanizing birth and making birth more traceable, something that we could move from this wild and animated and kind of like, what is this thing happening in the body? Let's tame this. Let's tame this. Let's tame the people who do this. Let's find a way to confine them. And so, like putting you in a bed when all you want to do is move, right? Having you on your back when all you want to do is be upright or in different positions, which would be so much easier to birth in. The surveillance that happens, during the actual birthing process, right? Looking also at the body in this way that if something's wrong, it's you. Not the way we've designed the system and the care, but you're the one, right? If something's wrong, it's because of you. So when we have that as a framework, right, as an underpinning framework, then there's a lot of instances where because of how we've defined an experience and what the ideal experience is and where you should be within. So at this stage, you should be this dilated or at this hour, like there's all these sort of rules. And if you kind of don't fit into that for whatever reason, then it's like, a conversation is introduced around intervention, right?
being
And
being induced.
being induced, right?
Pitocin and the whole thing, which
Pitocin,
just is an
right?
unnatural way to progress in birth.
Exactly.
Right. So they're
Exactly.
establishing a very unnatural environment to give birth in, which results in an unnatural birth.
Yeah.
It's
And I,
essentially what
I
you're
would say
saying.
too, like it's like birthing in captivity, right? Like think about the safety that's necessary for you to have intimacy. Like you don't want people hovering over you. You want bright lights and somebody walking in the room every 5 seconds.
Yeah.
Like that does not make you relax. And so we don't even think about what it's like for someone to be in a state of space where they're vulnerable, in an altered state of consciousness, like in their body. And then a door is flung open and then like six interns walk in and someone sticks their cold hands up in your cervix.
Right.
Like, what is
Yeah.
this? Right. And so, but it's your fault that you're not relaxed. It's your fault that you're not opening. Like, we have language like failure to progress. Like, why is it failure? How come we're not languaging in ways and thinking about the impact of that language and also thinking about the impact subconsciously? Because when people are in an altered state of consciousness, they actually fall into like very deeply and easily into sort of a trance-like state, right? And so that means they're actually more susceptible to the things that are being said around them. So we have to be actually even more careful with our language because people internalize it like even more because if you think about like where their brain waves are, right? Like the amplitude of these waves, right? Mean that they're in this altered state. So we're actually like not at all considering this actual experience that's happening. We're just seeing it as physical. We're not thinking about the greater thing that's happening with the brain and the body and this in our endocrine system and our sex organs and like everything working together, as well as like stuff that we can't really quantify, that's more sort of your own ancestry and your own stories and the things that are in your tissues that you carry forward and the epigenetics, right? We're not thinking about that. And this imprint, but the blueprint that we carry forward in the birth process, right? So if people were handling it in that way, I think that we would have better birth outcomes if we didn't just think about safety over safety, quote unquote, right? Over experience. Like, why are we not creating rooms? Like when I go to a birth, right? It's like we bring family pictures from home. We make birthing affirmations and put them on the walls. We'll have the children, if they have other kids, like help decorate them. We'll bring like things from people's pets or make it feel like their house. Like I've had like doctors walk in and be like, what is happening? Like we'll have candles. You're like, is there a seance happening in
You're like,
here?
I'm creating a
Oh,
comfortable environment for
yes,
my client, my patient. Yeah.
yes. And
And
they
that's
look
really
at that
a
too.
doula.
They look
Oh, sorry. Yeah.
And I was just saying the doctors appreciate that too. Like when they walk into a room and it's comfortable, it makes them relax too. So you actually, kind of create the experience that you want to reflect back.
And I wanted to ask too, like as you were just talking there, and I'm thinking, and that is the role of the doula really is to advocate, right? And to train these doulas too. And I think that's one of the questions I want to ask you about what you do at Mama Glow
Yeah.
with your, the doula homeschooling program and ultimately the a doula are they trained to think about what the woman is going through during that birthing process so that they can then advocate on their behalf, like all of the kind of I don't know, less physical things that an OBGYN may be monitoring through a machine, right? Is like that kind of
Yes.
process, that internal thing that's kind of happening. Is
Yeah.
that are they trained in that?
They learn everything, right?
That's what
Anatomy,
okay.
physiology, embryology, like down to
Hmm.
how a baby is even conceived. We start with
Oh
that.
wow.
We do a lot of science. They learn about the brain, and we're really into neuroscience because a lot of this process is really um, just dependent on the brain. And I think that also when we talk about postpartum, we're really talking about like a delicate state that the brain is in. And so we're also talking about, like neurogenesis, like coming on to that off of that experience of birthing. We're also, um we're looking at systems, right? And exploring how people can improve and impact on the systems that we're actually like, navigating, patient care navigation, um, everything from, you know, understanding the body, but also the shifts, right, that the body has to make. And so understanding the anatomical changes that happen by trimester, what happens at appointments, everything. Like they have to learn all of that foundational stuff. And then on top of that, they're also learning at the same time, how to anticipate people's needs and provide care. Many people who come to this are already like kind of caregivers, or they're like in healing arts or yoga, Reiki, massage. People are already kind of in these areas typically. So this is like something that kind of feels not as foreign to them as a concept, in terms of it's just like almost like an add-on to what they already kind of are doing. And I would say that, a big thing too is just like helping them to, navigate situations where they're safe also, because it's not always that doulas are welcome into childbirth settings, not all the time. Some physicians are not with it.
I
Some health.
wanted to ask that. What is the perception of doulas to
Yeah.
midwives over OB? Are they generally welcomed to the bedside, so to
Yeah.
speak?
So
Or
so doulas are on the federal agenda. And so expanding doula access has been sort of a push for the last, I would say, maybe like 4 to 6 years, right? Like really trying to,
at the
also
federal
bring,
level? Like,
uh-huh, yeah,
oh, okay.
absolutely. Yes. And so
So
there's
I'm sorry. So you're non-medical, but
mhm.
you are accepted as part of the medical industry. Then on some level,
Yeah,
then you're
we
allowed
design
into the
doula
hospital,
benefits.
into the hospital room and
Yes.
stuff. Okay.
Hmm.
Yeah, there's doula benefits for insurance, so people can get benefit coverage
Yes.
Oh
your
yeah.
insurance
I
provider.
have been hearing
Mhm.
about that, which is
Yes.
so cool,
We
like
designed
employers.
the very first one for one of the largest companies in the country, is in its second year of piloting. Will expand across the country
Oh,
soon, but
that's
we do it
amazing.
in like 3 states currently,
Uh-huh.
and also we like work with other. Yeah, so it's definitely something that people know we need to figure out how to integrate well into our healthcare system. Um, I would say that there's variable experiences though, it's like with anything. Some people are like, we're so excited about it, let's go. Other people are like, we don't want to, we're resistant. And I would say it's not institutional, but more like, person to person. So I'll have like in the same hospital, you'll have a couple of doctors that are super into doulas and then some who just aren't. And so the
Uh,
culture of each institution is sort of colored by how doulas are also treated as well as how patients are treated, right? And so you'll
yeah.
get feedback on whether a place is mother baby friendly or doula friendly. And we have almost like these markers for which ones are or are not. But I think like one of the things that's not being done well is that programs that exist on the state level and that are funded, through the state that should be marketed well, oftentimes people don't even know that are in those hospitals. They don't even know when doulas come, they're like, what is this? And it's like, this is like a state mandated program. And so the
Oh,
idea that
wow.
you have quality improvement, I think is an
Hmm.
issue, and just ensuring that people who are in charge of getting that message out, that it's not the doula that becomes the first person to say, hey, I do actually belong here as a staffer, right? Um, and so that's a thing. And I think also there's different types of ways to integrate the doula. Like there's obviously if you're working with a person one to one as a client, like say you're pregnant and you hire me, cool, and I work with you. But now also what's happening are hospitals are wanting their own doulas on staff. And
Oh,
so they can do like per diem. Yeah. So that's like something that's coming up now too, which is really common in Canada. Typically they'll have like people who are retired
uh-huh.
who will volunteer and do per diem work
Oh,
on different floors.
I love that. That's great.
Yeah, it's awesome. It gives people something to do, right?
Yeah, gives
Yeah.
you some
Um,
purpose. You're doing good. You're helping people.
right?
I mean, gosh, what's better
Yeah,
than watching a baby be born?
exactly, right? So
Um,
there's a lot happening for sure.
Yeah.
I have a question. So you said you've trained 3,000 doulas since 2018. What
Hmm.
does it take to become a doula? How long is the training?
Yeah.
What's the trajectory like to go from, nothing to being a doula?
Yes, I love that. So, so people can do that. So what we used to do in 2018, it started as a 3-day intensive program called the Mama Glow Doula Immersion Program, which was literally keeping people in this intense educational environment over the course. I think it was like a 26-hour training at the time. And we moved to online in COVID, um, after doing about, it would probably be like one class a month at least. And then we were doing that in New York and went then to LA, Miami, and Paris with our training hubs. And then COVID hit, and then we just stayed right here in New York.
Of
And
course.
what happened is that we had to shift it to online within 3 weeks. And so we tested one of our trainings that I thought was easier to integrate online. And we had a lot of people take it and it was awesome. So then we said, okay, we're going to now move the foundational training to online and see how that works out. And we were able to get it done. And so what it is like now, the configuration that we've sort of stick with now, which is once a week over 6 weeks, people come for the course. It's 3.5 hours. In that time frame, they go through each module, which are 6 modules. And then they have this student portal where all their coursework is listed, their homeworks, things like that. At the end, if they'd like to be eligible for Medicaid reimbursement, then they take a test. If they don't want to, they don't have to take the test. And then they have to complete what's called a certification packet, which includes some prerequisites before they finish the certification, including like some reading of books and doing some essays. It's attending 3 live births and then getting documentation for those births that they attended. It's taking a couple of, courses like CPR for infants and newborns, and then, or I should say, infant and child CPR, and a couple other or breastfeeding, right? So these are breastfeeding observation, I should say. And so these are things that like would go towards our certification. And then it's like being active in the community, like getting out there in the field and, going and attending births and making friends with people in community can help you to find folks who are like, yes, you can back me up for this birth, or you can, come to a prenatal appointment and just like really learn, right? What we do a lot is for novice doulas, we match them with mentors. So they're like in a buddy system and they have someone that they can like talk to. So say they're heading to their first birth and they're nervous, they have like a mentor that they connect with. Most of our programs that are service related for our different partners have this component. And I find that that's really helpful for people who are just starting. We also offer professional development support. So people want to complete their certification in a certain time frame, then they join us for a course that accelerates that process for them and provides accountability and things like that. So it's not a difficult hurdle, like it's way more difficult to, do something like midwifery because like the state by state, like there's different, requirements and also different laws in place around practicing midwifery even. And so, and it's also cost prohibitive to take that education, right? Like most people are not able to afford it, but then also depending on where you're practicing, you may not even be able to practice in the state that you even live, right? And so it's a
Why would that be?
because the laws are different by state.
Just
And
because,
because we have
okay.
designations for midwifery. So
Gotcha.
we have like traditional midwife, certified professional midwife, certified nurse midwife. And depending on the state you're in, like what you can do. So can you practice in the hospital? Can you do home birth? Are you licensed to, like, it's like all of these things differ by every state. So, so you have to know so say I get trained in Florida, right? I have to know what the laws are for Maryland if I want to practice there. And I have to make sure
Gotcha.
that where I'm practicing in Florida actually is going to give me the credential that I need to actually practice in Maryland, which most people don't necessarily know. They just know they want to go to school and do this. And so they haven't thought that far ahead. And so sometimes you have to then go through another logistical hoop that you have to jump through to now figure out how to get the proper licensure because your education doesn't carry over because of where you went.
But doula is not like that though. And where
So
you
that's
get
just
certified
midwifery.
that's just okay, just to be clear.
This is much
Uh,
easier.
Because you don't have the actual medical side
Component.
that's putting all the extra rules and regulations and
Yeah.
everything on you.
Yeah.
yeah,
It
and
Gotcha.
makes no sense.
That's actually, I mean, for what it is, that's actually, I think, a pretty short path to get to
Yeah.
that. Actually, that's
Yeah. It's
pretty
not that much
accessible to
work.
people.
It is accessible. It's affordable,
So,
for the
yeah, a
most.
lot easier than going to college for 4 years.
Yeah. And we also have collegiate programs. Like our training program is embedded at Brown University, where I'm a professor and I teach it to students who are like
oh,
OB-GYN, public health, medical anthropology, public health students, people who are doing bioethics. Like those are the students that I teach there. And they get this course over 12 weeks. And so there's more components to it because they're taking it over a semester than people who are taking it over 6 weeks. So,
Right. And there you go. First half or so of our conversation with Latham Thomas from Mama Glow. We'll be back next week with the concluding portion of the conversation. We'll bring you all our wrap up and takeaways and everything at the end of the next episode. So real quick, why don't you take us on out of here, Heather?
Yeah, so that's it for this dose of Healthcare Uprising. Until next time, keep looking for the good in the world. It's sometimes where you least expect it.
This has been a Shut Up production.